Sure, I'm Dr. James Chang. I'm Chief and Professor of Plastic Surgery at Stanford. During residency, I became very interested in hand surgery. So the majority of my practice is related to hand surgery and microsurgery, where we transplant body parts from one part of the body to another. Within hand surgery, I'm very interested in operating on children. I'm interested in flexor tendon injuries, which are specific injuries to the tendons that allow you to move your fingers, nerve cases, as well as bony work. So in hand surgery, we're able to operate on all types of tissues, from bone to skin to nerves to tendons. Children are very interesting. First of all, you have to develop a rapport with the child in order to elicit certain physical signs of what they have going on. So sometimes you'll play with a child for a while and be comfortable with the child before getting the right diagnosis and treatment. You have to work with parents, and what I always say is, listen, I'm a parent too, so I know what you're going through, and so I try to treat their children like they're my children, and that really relaxes the parents. They also have these congenital problems that they can very well adapt to, and it's really heartening to see them come back with surgery or without surgery, but both doing very well. The assignment was an intimidating task because my mentor, Rod Hentz, edited the previous volume. It is a beautiful piece of work, and my job was to see if there's any area where we could tweak and renew and refresh. And so when I took this task on, I thought it'd be nice to get the world leaders in hand surgery to participate. In other words, those people that at that time, right now, are the known people not only in the United States or in England, but throughout the world. And I think we managed to make this book truly international. There are authors, many authors from Asia and Europe, South America, all over, that have really made this international. I think that speaks to how medicine is going, and especially in the field of hand surgery. We have much to learn from authors and doctors all around the world. So this book puts together that world experience into one textbook. Also, you will notice that the color diagrams are phenomenal. The previous edition was black and white, and Elsevier put a lot of money into making these color photos. And some of the first people who've seen the book said, wow, this is like going from black and white TV to color. And they love the visual aspects of the book. I think that's where Expert Consult comes in. In each chapter, if you look on Expert Consults, and again, my residents showed me this because I was a bit skeptical about Expert Consult and how it would work, but my residents showed me that once they scratch off that code, they upload it, and that's what they use on a day-to-day basis. They don't feel like they have to lug the textbooks around. They love having the books on their shelf and refer to them, but on a day-to-day basis, they'll go through Expert Consult, they will pull up an article, and then when there's a little icon next to it, they'll click on it and get to see the video of the operation, which is truly unique. They tell me this is different than just searching the web. When you search the web, you do not know the quality of the content. But since this is the whole textbook is online in Expert Consult, they can be assured that when they click on it, the content is quality. Well, it's a tremendous honor. I think anyone who's interested in academic hand surgery who would be offered this honor would want to do it. It really allowed me to not only show what hand surgery is, but actually for me, selfishly, I was able to learn all of hand surgery again. By editing and proofing each chapter, I learned a lot of hand surgery. So in that respect, it was a project over the last few years that allowed me to put my stamp on what I think hand surgery should be and who those people are, and have those people be my teachers again to learn hand surgery.